My name is Stephanie Chakia, and the body system that we've previously discussed that is of the greatest interest to me, which you might already know, is part of the nervous system. The nervous system includes the sensory organs, such as the eyes and ears. Ophthalmology is the specialty that I'm most interested in. Um, Although the eye seems like such a small part of the body, there are multiple subspecialties that take care of this small but very important organ. Um, I'm sure that everyone who's ever worn glasses at some point has seen an optometrist whose main specialty is refraction, general comprehensive eye exams, and dispensing glasses prescriptions. Opticians make glasses, and then there are the medical doctors that are responsible for more complicated facets of care. There is so comprehensive ophthalmology comes in two forms. There are strictly medical doctors who monitor and treat the eye. Um, there are the surgeons who perform a multitude of procedures when there is actual pathology present. There is, like I said, a lot of specialists for each part of the eye. We have the cataract surgeons who specialize in the anterior segment and cataracts, glaucoma surgeons who focus on glaucoma, which is a disease of the optic nerve, which is actually cranial nerve number 2. There are cornea specialists whose main focus is on the cornea, which is that clear epithelial layer in front of the eye. These surgeons perform corneal transplants and some other more advanced procedures. It would be also a LASIK surgeon if, it's very familiar. Then there is neuro-ophthalmology, which is a field that focuses on the pathway in which vision is processed by the brain. So basically, how light lands on the retina and then it goes through the optic nerve, and then it gets processed in the parts, the occipital lobe of the brain, and basically they're in charge of that actual pathway. There are retina specialists, which is my favorite part, which they focus on the nerve and blood vessel lining in the back of the eye. They perform surgeries such as retinal detachment surgery, repair surgery, in-office procedures, as well as intravitreal injections for the treatment of eye diseases such as macular degeneration or diabetic retinopathy and a bunch of other things. Then there's ocular plastic surgeons. They reconstruct the orbits after maybe a trauma. They perform lid surgeries such as blepharoplasty, which, a lid lift. They even perform a surgery called enucleation, where an eye that no longer sees and is sick, for lack of a better word, will be removed from the eye socket. And there's also a very specific subspecialty, which is ocular oncology. And they treat cancer of the eye. For example, there's choroidal melanoma. Now there's the anterior segment of the eye, which includes the cornea lens, sclera, conjunctiva. Then there's the posterior to the lens is the anterior chamber, optic nerve, the retina, which includes the macula and the fovea. There are 6 extraocular muscles that move the globe. There are the inferior, superior, lateral, and medial rectus, and the superior and inferior obliques. These muscles are attached at an angle to the posterior part of the eye, and they are responsible for all the movements of the eye. For example, the superior oblique moves the eye down and out. So obviously the eye is definitely my favorite part, but learning about all the other parts in the anatomy and how the cornea's epithelial cells and how they work and that the nerve cells and just the whole, it's just all brought it all together for me. And it's also just solidified my love that much more. So thank you very much. And